Hey, future nurses, ready to ace your NCLEX? Today I'm tackling some top case study questions to help you prepare. Let's dive in. First up, Case Study 1, Acute Respiratory Distress Syndrome, ARDS. Our patient is a 72-year-old male with COPD, presenting with shortness of breath and confusion. He's on 6L nasal cannula with an oxygen saturation of 85%. ABGs show pH 7.28, PaCO2 55, PaO2 60. 1. What is the nurse's priority action? A. Increase oxygen flow to 10L/min-B, call the provider for immediate intubation. C. Place the patient in high Fowler's position. D. Administer a bronchodilator as prescribed. Answer. C. Place the patient in high Fowler's position. Testing strategy. Use the ABCs. Airway and breathing take priority. Next, the provider orders BiPAP. Which finding requires immediate intervention? A. Patient's respiratory rate drops from 30 to 8 breaths per minute. B. Patient's O2 saturation improves to 92%. C. Patient states, I feel short of breath but better than before. D. Patient is coughing up pink-tinged sputum. Answer. A. Respiratory rate drops from 30 to 8. Testing strategy. Recognize early versus late signs of respiratory failure. Moving on to Case Study 2, Myocardial Infarction, MI. Our patient is a 58-year-old male with crushing chest pain radiating to the jaw. BP 160/90, HR 110. 3. What is the nurse's priority action? A. Obtain a 12-lead ECG. B. Administer sublingual nitroglycerin. C. Give morphine for pain relief. D. Check troponin levels. Answer. A. Obtain a 12-lead ECG testing strategy. Use the nursing process. Assessment comes first. The ECG shows ST elevation in leads 2, 3, and AVF. What does this indicate? A. Anterior wall MI. Lateral wall MI. Inferior wall MI. Posterior wall MI. Answer. C. Inferior wall MI. Testing strategy. Know your ECG leads. Leads 2, 3, and AVF correspond to the inferior heart wall. Next, Case Study 3, Diabetic Ketoacidosis, DKA. A 22-year-old female with type 1 diabetes presents with nausea, vomiting, Kussmaul respirations, and a glucose level of 420 mg/dL. 5. What acid-base imbalance does the nurse anticipate? A. Respiratory alkalosis. B. Metabolic acidosis. C. Metabolic alkalosis. D. Respiratory acidosis. Answer. B. Metabolic acidosis. Testing strategy. DKA causes excess ketones leading to acidosis. The nurse starts IV insulin. What is the most important lab to monitor? A. Serum potassium. B. Serum sodium. C. Blood urea nitrogen. BUN. D. Hemoglobin A1C. Answer. A. Serum potassium testing strategy. Insulin pushes potassium into cells, potentially causing hypokalemia. Now let's tackle some standalone questions. 7. A nurse is caring for a client on warfarin therapy. Which finding is most concerning? A. INR of 2.3B. Dark brown urine. C. Bruising on the arms. D. Small cut bleeding for 5 minutes. Answer. B. Dark brown urine testing strategy. Recognize internal bleeding. Dark urine may indicate hematuria. 8. A client with a C6 spinal cord injury suddenly develops a headache and BP of 210/110. What is the priority action? A. Lower the head of the bed. B. Administer IV antihypertensive medication. C. Check for bladder distension. D. Give oxygen at 2L/min. Answer. C. Check for bladder distension testing strategy. Think autonomic dysreflexia. This life-threatening complication is often triggered by a full bladder or bowel. 9. Which client should the nurse see first? A. A post-op hip replacement patient with 7/10 pain. B. A COPD client with an O2 sat of 88%. C. A client with new-onset confusion and restlessness. D. A stroke client with slurred speech from 5 hours ago. Answer. C. New-onset confusion and restlessness. Testing strategy. Recognize early signs of hypoxia or sepsis. Which medication should the nurse question? A. Furosemide for a patient with potassium of 3.0. B. Insulin for a diabetic patient with blood sugar of 220 C. Beta blocker for a patient with BP of 130/80. D. Acetaminophen for a post-op patient in pain. Answer. A. Furosemide for a patient with potassium of 3.0. Testing strategy. Furosemide, Lasix. is a potassium-wasting diuretic. How did you do? 12, 15, correct, your NCLEX ready. 8, 11 correct, almost there. Keep practicing. 7 or below review test-taking strategies and content areas. Want more? Drop A in the comments.